For joining us for the Masters of Science in Athletic Training virtual information session. My name is Tom Crash. I'm our Director of Graduate Admissions, and I'll be our host for tonight. Um, I'm joined by Dr. Russell, who will introduce here in just a minute or two. The event should take 30 or 40 minutes. Dr. Russell has a great presentation prepared, and the goal of this event is to help you preview your experience of what it would be like in the CU Lock Haven athletic training program. I'm confident our program has a lot to offer, and this is a great opportunity for you to do a deeper dive and look to see what your future might have in store if you choose to become a bald eagle. This event is being recorded, so whether you are watching the live version or you are watching the recording, we appreciate your time, and please do not hesitate to reach out to Dr. Russell or myself. We work for you, and we are certainly happy to do so. But before I go any further, Dr. Russell, would you mind introducing yourself?
Sure. Hi, my name's Dr. Jody Russell, and I'm actually in the start of my 20th year here at Lock Haven. And I have been the program director for their Masters in Athletic Training program here for the last 2 years. And prior to that, I served as the clinical coordinator. So I was in that role for over 15 years. Athletic training education is really my passion. I had my undergraduate degree in athletic training. I went on, got my master's degree in health and physical education, specializing in athletic training. And then eventually I got my doctorate right down the road here at Penn State in kinesiology, again, focusing in on athletic training. So that's a little bit about me.
And Dr. Russell, what is your area of research that, do you have an area of specialty within the program?
I really look at trauma
Mhm.
and brain development and concussions. That's probably my biggest area. And then also I dive into a little bit of therapeutic modalities.
Mhm. All very relevant topics in sports medicine in 2024. So that's great. Well, thank you, Dr. Russell. I appreciate it. I think we're good to go ahead and start the presentation.
So why the MS in athletic training at Lock Haven? So I like to think that we've been doing athletic training here since the 1970s. So for a very, very long time. So we have a really, really rich tradition. Um, and that's something that we pride ourselves on. And our students, they become our alums, they become our peers, our colleagues, and we really like to foster that relationship. We also do a lot of giving back to the community, giving back to the profession. We really weigh in on service quite a bit. But our program, again, it's been well established. We transitioned to the Masters in Athletic Training in 2018. So we were one of the earlier schools that decided to transition before it was actually mandated to by our accrediting board. But you'll hear probably me refer a couple times throughout this presentation tonight, the word family. And that's really, really what we think our program is. It is just family. You're in class with other students, but they really become your family. Your faculty, the athletic training faculty, they become like your family. So we want to make sure that you succeed in the program. Ultimately, our goal is to make sure that you pass your board of certification, and we're going to make sure that our program is individualized to you so that you can succeed. We do like the fact that our class sizes are a little bit smaller. We're about 15 in a cohort, which makes it hard to just skate by. Like, you're going to know your material, you're going to know what you're doing. It makes your clinicals when you go out more of a one-on-one experience. So you're out and you're doing. And I think that's a really neat thing about athletic training education is that you get the didactic information. So you're in the classroom and then right away you're going right out to clinical. There's no waiting around for that. So I think that is another key part is that you're really getting to apply immediately what you're learning in the classroom.
Yeah, and you mentioned a couple of things there, Dr. Russell, that I think are really important that I wanted to highlight. The first one is the fact that the program's been around for 30, 40 years now, right? So that speaks to actually maybe even a little more than that. I don't think I'm doing my
Yeah,
math
about
right.
50
About 50,
now.
yeah. Wow, okay, I wasn't even close. But the reputation of the program is so important because the reputation often will precede people when they're applying for internships, when they're applying for jobs, is like, oh, you went through the Lock Haven program. Okay, we're familiar with their quality. So I think that's so crucial. The other is the factor of the community aspect of the program and how it is a really tight-knit family-like atmosphere. The social fabric is very strong. And one of the things I would encourage students to do is to follow along on the Facebook page that they have. And what you will oftentimes see is like the group will get together and go out for dinner, and they have all these outing or social outings, and it's not just what happens within the brick and mortar of the classroom. That everyone is very closely connected to one another, and I think it makes the experience that much more enjoyable. And if I'm not mistaken, the program completion rate is around 100%,
Pretty close to it.
pretty close to it. So,
Yeah.
so that means that because the experience is more enjoyable, right? Is like you're basically, going through the AT program. It's like it's a team sport, and I think it makes it enjoyable and will make you a better student because of that. So those are absolutely true things, and I'm glad you mentioned them.
Yeah, very much so. So an overview of our program here. We are accredited by Katie, and that's an important piece as you're navigating and looking at programs. You want to make sure that they're accredited. We do have interdisciplinary faculty. So not only do you have athletic training specialists teaching your classes, but you have someone who is a pharmacist. We have a physical therapist, and we have exercise physiologists. So we really branch out. And even with our athletic training faculty, we all have different areas of expertise. As I stated earlier what mine was, but one of our other faculty, she really specializes in the psychological aspect of injury. Another faculty looks at a lot of the biomechanics. So we each have our own disciplinary expertise area. The big thing then next, and everyone always wants to know, the percentages, the pass rate. So we have 100% board pass rate. So that is exciting to report. And our graduation rate is 94%. We recently actually had a student that decided he wanted to go on to med school. So he decided this was a great stepping stone, but I need to go and finish that degree. And so that's what drops that down to 94%. And then the other big factor, as Tom was mentioning, we do have this big alumni base, which helps with that employment rate. So right now we have 100% employment rate. A lot of times, actually just yesterday, we had one of our current students accept a job, and this is December, and he's not graduating until May. So the word gets out quickly. We have a lot that are interviewing already as well. We do have scholarships and graduate assistantships available, and I'll speak about those a little bit later. This really is a perfect fit for students that are majoring in exercise science, biology, health science, potentially biomed or psychology, but it really is a good fit with just having that extra science background. And we do have a dedicated athletic training classroom. We have an exercise physiology lab that we use, and which is interesting and pretty unique. We have a gross human anatomy lab where you will actually get to do cadaver dissection. So that's human cadaver dissection, and I'll talk about those classes here soon.
And I just wanted to plug, if you go to the program website, you will see video tours of these facilities too. So if you're looking to, again, go a little bit deeper into the program and you want to, actually tour these facilities and it's not easy for you to get to campus, we have some great video tours that Dr. Russell has led that are on demand.
So what our coursework looks like, we have 60 credits. 45 credits of those are didactic, so that's like in the classroom, and then 15 credits are clinical. So you can see how we really stress our clinical and the fact that a quarter of your credits are dedicated to the clinical. Courses are offered in what we call a block format during the first year, and this is pretty much that you're in class from during the fall from about 9 until 1 or 2, Monday through Thursday. You have off Friday, because majority of the students are doing clinical at a high school and Friday is Friday night light, so it's a long day. So we let you sleep in a little bit. So that's what we do with that first semester. And then in the spring, we have that block format Monday through Friday. And again, you're in class from about 9 to 1 or 9 to 2 with the same people in your class. You're sitting in the same room. We do give you some breaks though. But a majority of our classes are also taught in person at the Lock Haven campus. There's only one course that is taught online, and that's during your last semester where you also will be doing an immersive clinical experience. So as I said, you have cadaver dissection. You actually have 2 semesters of cadaver dissection. And you have 2 semesters of musculoskeletal eval and 2 semesters of therapeutic interventions and treatment. So I'll talk a little bit more about that in the next slide, I believe. But we really think it's important during that first year that you get all your hands-on skills. So that way you've got more time to practice those skills in the clinical setting and become really proficient and become basically a master of those skills. And then also you'll see that we have courses in pharmacology, exercise prescription, and nutrition. So those are more like what we refer to as our ancillary classes. And they might not be necessarily your really hands-on courses, but it's information that's going to be important for you to become a well-rounded athletic trainer. So this is actually what our course load looks like. So we start off in the summer, typically right around the beginning of July, and we have a fundamentals of athletic training course. And in this class, you learn basic emergency care techniques. So things such as splinting, spine boarding, you become first aid and CPR certified. We then move into some taping and wrappings, into communication and cultural competence, because it's important to just be aware of the diverse populations you're working with. And then I also teach a session on concussion evaluation and concussion rehab. And all of that is done in that summer because we want to prepare you for your first fall clinical, which in most cases, it's going to be a football experience. And if not a soccer experience where you're going to see quite a bit of concussions, you're probably going to have some emergency care. So we're just making sure that you're prepared in that summer to start right away during preseason. So pretty much you finish up your class in early August and you have a couple of days off, and then you start right in preseason, and it's no longer you're observing, you're doing. And I think that's an important piece. So year one, again, it's our first block. You have an evidence-based medicine, which is like a basic research course. And then functional anatomy 1, which is lower body cadaver dissection. Eval techniques 1, which is lower body eval. Therapeutic interventions 1, which is more of a foundation class of how to start planning your plan of care for your patient. We also look at a lot of the different modalities, so things such as e-stim and ultrasound. And then I'll get to the clinical experience in a moment. But let's look at year 1 in the spring then. And you can see we have general medical conditions. So this is learning how to recognize maybe some dermatological conditions or cardiovascular conditions. So things that are still going to come through the door, and you might not be the expert in that, but you can actually recognize it and then refer them on to maybe a specialized physician. Functional anatomy 2, and this will be upper extremity dissection, eval techniques 2, which is upper body eval, and then therapeutic interventions 2, which is a joint by joint rehab class. So really honing in on how do I rehab a specific injury, and then clinical experience 2. So those first 2 clinicals, those are going to be more in your traditional setting. So you would have one experience that would be at high school, and then one that would be at a college, just to give you a diverse population. Because if you're at the college all the time, you wouldn't be able to recognize it and see some of the things that you might in a pediatric patient. So it's important to really expose yourself to a diverse patient population. And those clinicals are pretty local, within about a 30-mile radius. And we do our best. If you have one that's further away, let's say in the fall, you're going to be at a clinical in the spring that's relatively close. So we try not to have 2 semesters where you have to drive 30 miles to your clinical. So then we move into year 2. And as I said, this is now your ancillary classes. So you've learned all your hands-on skills during the first year. So this is more of your, you can see administration and organization, pharmacology class, applied sport and exercise science. So this is more of a exercise prescription and nutrition course. And then psychological aspects of injury and illness, because we not only deal with the physiological injury, but we also deal with what's going on in our athletes or our patients' mental state. And then our clinical experience 3. Clinical experience 3 is an interesting one. I think it's relatively unique in that you spend half of your time in our rehab setting. So you're doing long-term rehabs, post-surgical, it could be acute rehabs. So really focusing on those skills you learn in therapeutic interventions 2 in the spring. You're really fine-tuning those then in the fall. So that's half of your clinical. And then the other half are ancillaries. So we see right now athletic training is really expanding into a lot of different clinical settings. So we want to make sure that you can see what might it look like if I were to take a job in this type of setting. So some of the places you get to go, we have a local chiropractor who focuses on a lot of functional movement, a lot of rehab. So not necessarily like your traditional chiropractor. You spend some time with a pediatric orthopedics. We have a local physician assistant that you get to spend a little time with. You get to spend a day at the Frito-Lay company in Williamsport, which is right down the road, to see what it would be like to work in the industrial setting. You get to do a ride along with the EMTs, really focusing on interprofessional education and trying to figure out what is the role of the EMT, what are they doing, and how can I work really well with them as an athletic trainer. You spend a little bit of time at a family practice, so really focusing on those skills you learned in gen med conditions. So you might be seeing a lot of runny noses, but you're actually getting to see what that's like, or someone might have an ear infection and you can see what that positive, what it looks like when you're looking in that ear and it's infected. And then you get to spend a week with our sports med clinic. And with that, you get to spend a day with the foot and ankle doc. You get to spend a day with bracing, a day in the clinic, and a day observing orthopedic surgery. So it's a lot. It's a lot of different moving pieces, but it really exposes you to a lot of different populations of people and a lot of different potential clinical sites where you could work. And then your last semester, as I said, is a current issues class, which is online, and your clinical experience 4. And your clinical experience 4 is going to be your full immersion clinical. And this is really what everyone looks forward to because it is your culminating experience. At this point, you have learned all your skills and you are so close to being able to practice on your own. And this is really giving you a taste of that. So you spend the whole entire semester at a clinical site, and you're pretty much there on a full-time basis. So we say you average around 40 hours a week at that immersive site, really just trying to, okay, here's my area of weakness. I want to work on this. I want to become stronger in this area. So when I'm out on my own, I've got this. And we really try to make sure we're matching that immersion experience with what your career goal is. And we really think that's important. So if you want to work at a Division I setting, we're going to try to make sure that that immersive site is going to be at a Division I setting for you. Or if you really want to work at a high school or a clinic, that's how we will work with you. As I said, we've been doing immersions for a very long time, well before it was mandated. So this is probably about our 15th year of doing immersion. So we have it down pretty good. And we also have an expansive list of places where our students have gone, and we've made a lot of connections there. What's also nice about your immersion is that we have a lot of students that have done their immersion, and then based off of where that was, either get hired at that immersion site, or the preceptor that they worked with knows someone else, and it helps with the connections to get them their first job.
And Dr. Russell, one question that I frequently hear on the front end of things is, I have my bachelor's in athletic training, or I have my bachelor's in health sciences or exercise science. What are the difference, like what's the difference between an undergrad class in health sciences and a graduate level course in the master's program in athletic training?
Sure. Well, the undergrad is pretty much preparing you for graduate school. So if you have your bachelor's in health science, that's great, but it's not going to get you the you're not going to be able to sit for the BOC. So you're not going to be able to become an athletic trainer unless you go through a graduate program. The academic rigor is definitely more so than it is at the undergrad level. We do expect a lot out of you, and the commitment level to be there. There's really no excuses. You're here to become an athletic trainer, and that's what we're expecting. All of your classes focus on just becoming an athletic trainer, not let me give you, a physics class or
Mhm.
a history class. Like, you're specifically taking courses that are going to give you the information you need to pass the BOC,
Mhm.
and which is our board of certification, and B, to become a proficient athletic trainer.
Okay, great. Thank you.
Sure. So these are just some of our more recent immersive placements. So you can see we have a lot of Division I programs, and that's really what a lot of our students want, that exposure. Whether they decide afterwards that's not what they want to do. We do have some that say that, but others, Anne, who is featured here, she did her internship at University of Miami. She stayed at University of Miami for 2 years, and now she's actually working at University of Arizona now. So she love that Division I atmosphere, and that's where she's staying. But you can see also we had someone that was at the Rothman Institute. They really were thinking that they wanted to be in a role of an athletic trainer in a physician office, dealing with more of an urgent care setting, but those people coming in with an ankle sprain, or they dislocated their shoulder and they're going to that urgent care, this is where he wanted to be. So he got some exposure at the Rothman Institute. Sporting Kansas City, also Philadelphia Union, both of those being professional soccer. Orthopedic Associates of Lancaster. So if you know of Spooky Nook, if you don't, you should just check it out. It is a crazy complex in Lancaster, but OAL supplies athletic trainers outsources them to Spooky Nook. And Spooky Nook is really used heavily on the weekends for youth tournaments, and it's interesting. It's an interesting place. And then we also have had people at numerous high schools, because that's what their career goal is, to be at a high school. So again, we're pretty much have placements all the way out west to Arizona, as far south as Miami, as far north as University of Maine. So as far as where they've been. So that's just some of our places. So career paths, I love this picture. So this is the faculty and our graduates from last year. So this is always a bittersweet day when they graduate, because they've been with us for 2 years. We've seen them in their highs and their lows, but at this point is when they're no longer our students, and now they become our colleagues and our peers. And that's just part of that, being a family and staying in touch with them. And it's just really, it's such a great day. But looking at the career paths, it used to be that everyone went into the traditional setting. So college and universities, they might be hired by a school district, they might be hired by a clinic and outsourced to a high school, and then in professional sports. But we really have seen a growth of athletic training, and people recognizing that we are a healthcare profession and that we have a lot to offer. And you can see that it's gone to physician offices, rehabilitation clinics, the military, performing arts. So things such as like having them on Broadway, Cirque du Soleil. And then even in the industrial setting, you hear a lot about preventing injuries, and this will help with work production. So you see athletic trainers at Amazon, at Frito-Lay again, at Mack Truck. So, just trying to increase work production. And so there's a lot of prevention. So, there's a couple different domains in athletic training. And if prevention is like your area that you love, that industrial setting might be the place for you. So a lot of different emerging settings that are coming out, and just the need and the demand for athletic trainers right now is really has skyrocketed. And you can see that it's going to continue to increase, not only nationally, but simply in the state of Pennsylvania. So you can see about a 0.25% growth for new positions. So again, just recognizing the importance of an athletic trainer. You see in the news a lot, unfortunately, about different athletes that had died and they didn't have an athletic trainer, and people are seeing, wow, they really do have a place, and we're seeing that increase in new position growth. As people, again, become more aware of sports-related injuries at a young age, the demand is expected to increase. So places like Spooky Nook, where they're having these youth tournaments, Pop Warner, football leagues, anything where you're seeing the youth. I know, like, you have AYSO soccer, like, okay, you might start seeing an athletic trainer at those practices, at those games. So that's another area where you might see an increase or a growth. A variety of work environment options. So again, we're seeing really the gates are opening in so many different areas and so many different work environments for athletic trainers. And there's a significant labor shortage right now, which is a good thing, resulting in an increase in baseline salaries. We're seeing sign-on bonuses, we're seeing improved work-life balances, and better benefits. So it is like the prime time to become an athletic trainer. So you're timing it just right.
Yeah, the one thing that you should be looking at as a prospective graduate student, say like you already have an undergrad degree, you're looking at a graduate degree, is what is the return on my investment going to be? In this case, your investment is going to be 2 more years, and the cost of going to grad school, right? And the ROI on your master's in athletic training will be very, very high. Sports medicine is a huge area of growth that you're going to see when you see that new position growth is expected to grow between 23 and 24%, depending on the state. That is huge. So it is a good time, and it's supply and demand, right? So if there's a lot of demand for these professionals, then that means that the compensation package will probably be pretty good. So it's a good time.
Just a little snapshot of some recent alums and where they are right now, because I know that's important. Like, where are we placing our grads? We have someone who is an athletic trainer supervisor at OAL, at the Orthopedic Associates of Lancaster. So he's just overseeing the placement of all the athletic trainers in Spooky Nook, in the high schools, in the colleges, anywhere that OAL outsources to. A physician extender athletic trainer. So basically in an orthopedic office, he is basically the person that's in charge. They're coming in, they're seeing him, and then he gets to refer them to basically the docs that are there, or decides the plan of action. Out west to Allegheny County, so out near Pittsburgh, we have an athletic trainer that is working with the Philadelphia Union, assistant director of sports medicine at Shippensburg. And there is an update to this. I forgot to put this in there. Head athletic trainer at Temple University. So she recently got a promotion. So she's now the head athletic trainer at Temple. We actually have 3 athletic trainers at Roanoke College. That became a hotbed for our alums. And then you can see even just a head athletic trainer locally at Canton area junior, senior high school. You know, this is a small area, small high school, but she's doing wonderful things out there, and she's outsourced through UPMC as well. So I mentioned earlier that we do have graduate assistantships and scholarships. And, you know, Tom talked about the return of investment. But it's also nice if you don't have to pay as much for your tuition. So our graduate assistants, we do have at this moment 3 graduate assistants. They each work about 10 hours a week. And you can see that they get 6 credits of tuition waiver per semester. They get approximately $1,500 stipend per semester. And our 3 graduate assistants, one focuses on supervising our undergraduate A&P labs. She helps to coordinate tutors and our open lab times that we have for our undergrad students. We have one that does some research with faculty, also helping out with some administrative tasks. And then another graduate assistant who is more so in charge of program recruiting and marketing and really getting on our social media outlets. Then we also have 5 different scholarships. So we have our AT Alumni Scholarship, which anyone that is incoming is eligible for that one. The David Tomasi Scholarship, who's the founding father of our athletic training program, and the Yvette Ingram Scholarship. Those are ones that you can apply for during going into your 2nd year. And then we also have specific faculty scholarships within our department. And once you become it's a Pennsylvania Athletic Training Society member or an NATA, the National Athletic Training Association member, you're then eligible to apply for those scholarships as well. And then the EATA, which is the Eastern Athletic Training Association. So we start off state, we go district, and then we go nationally. So a lot of opportunities that are there. And these graduate assistants are just in our department, but we've also had past students take graduate assistantships in our rec department with student success. We also have students that have been RAs as well, resident assistants. So there's definitely ways that you can help yourself out and help your tuition bill not be as high. So what's next? What are the steps to become one of our students? So there is an online application, and this is through the centralized system. It's called ATCAS. I think many of you have either started your application or hopefully will soon. So that's where you would apply. There's a lot of different pieces to that ATCAS, but one, you do need to supply your college transcripts. We do have a minimum of a 3.0 GPA. The GRE is not required. You need to have completed 75 observation hours under a certified athletic trainer. Statement of professional goals needs to be included. 2 references. We actually don't require letters of recommendation. We just require contact information for 2 references, and then we'll reach out to them. And then you have an interview with the faculty. So once your application is primarily completed, you'll have myself reach out to set up an interview with at least 2 of our athletic training faculty. And this obviously can be done over Zoom as well, based off of your location. We do offer the opportunity, if you'd like, to come on campus to do that as well. It is nice, I think, for if you're able to see the campus, to get a feel of what it might be like being here. So we offer pretty much, we call it day in the life. So you can come and sit in class, you can talk to me, you can talk to the students, go to a clinical at the university here, and just sort of see what it would be like to be a student at the Lock Haven campus. So that's our application process. The routes to admission is our 4+2, which can be external or internal, 3+2, which is more of an internal route, but we do have, if you're attending Shippensburg or Millersville, we have a 3+2 option with those universities. And that's just more of an accelerated route. And there's my contact information. So if you have any questions based off the presentation or just in general, you can feel free to email me or give me a call.
And thank you, Dr. Russell. We really appreciate it. So that will conclude the live part of the event. Really appreciate everyone who joined us. Again, whether you're watching live or you're watching the recording, we again really do appreciate it. If anybody has any questions, please don't hesitate to contact Dr. Russell and myself, and we certainly look forward to hearing from everybody in the future. Thanks, everybody.